Meanwhile, President Trump and GOP leadership are confident in their plan to repeal and replace Obamacare on many levels. But what are patients saying? After all, isn't that what counts? What do they want from the new plan that Obamacare is not offering? Here to discuss this is two of the best. Fox News Medical Aid Team Dr. Marc Siegel and Obamacare architect and Fox News contributor Dr. Ezekiel Emanuel. Thanks, guys, for being here.
Hey, Brian.
So,
nice
Dr. Emanuel, I know you love your you like your plan. You're after all, you helped give birth to it. But if you could add something to it to make it better, what would it be for the patient?
Well, I think there are two things we really need to do. One, it's quite clear that the American public is upset about deductibles and how much they need to pay out of pocket before the insurance kicks in. We definitely need to bring that down. Interestingly, when the Congressional Budget Office evaluated the most recent Republican plan, they said deductibles would go up. That is going in the wrong direction. So I think we need to make health care more affordable.
Right.
And the flip side of that is we need to pay doctors and hospitals differently so that they actually are interested in keeping people healthy and don't just get paid when they treat the sick. And I think that's a lot of what the public really wants. Some of the things they really liked is, no deductibles, no copays for prevention. I think that's really important. No deductibles and copays for 3 primary care visits. I think that's also important to keep.
All right. Dr. Siegel, you know what's put out there now. You know what's got to be fixed. And the one thing that drives people crazy is these huge deductibles. They say, I might as well not even have insurance.
Well, listen, Brian, for that to come down, for the deductibles to come down, I don't think we can continue to spread our resources across the entire population. Let me say what I mean by that. The mandates are not popular. If we get rid of the individual mandate, then there's going to be more choice in the system. But what are your choices? If we leave all pre-existing conditions in place, then everyone is paying for everyone else. But listen to this. 5% of Americans use up 50% of our health care costs. 5% use up 50%. So that's why we have to separate out people with pre-existing conditions. Dr. Emanuel wants all the essential benefits in, but I think the government, we got to look at the role of government. The government should protect us against the plague, should protect us against hospitalization. The role of the government is not to make sure that we have no copay on a colonoscopy. I love colonoscopies. I love mammograms. I order them on every one of my patients.
Right.
But if you have the government making sure that isn't provided, premiums are going to stay high and deductibles will stay high. The government should play that role. We need an a la carte menu.
Right. That's one of the phrases I never thought I'd hear. I love colonoscopies, but I know what you're talking about.
I love what they do. I love what they find.
Well, let's hope he's not ordering them on every one of his patients, since people under 50 and over 75 should not be getting them. So we do need to be a little careful that we don't overuse and drive up health care costs without getting necessary benefits. Let me just say one thing. By cutting and having a, quote, a la carte menu, all you end up doing is asking people to pay for their own health care and to pay out of pocket. And that's not possible. The reason 5% of people are using 50% of costs is that they're sick. They have cancer. They have serious heart disease. Right. And they can't pay for all the services they need out of their own pocket. That's why we have insurance, to spread the costs across everyone and across a lifetime.
Dr. Emanuel, Dr. Siegel, having said everything that we want idealistically, the plan that Ryan put forward, the best you know of it, they're going to make some changes in the fourth committee and then bring it to the House. Can you give me 2 things you'd like to see practically change? First, Dr. Siegel, two things that Ryan's got to add.
Okay, first of all, I want to see high-risk pools. I want to see more choice, because you know what? Innovation cannot be covered by one-size-fits-all insurance. And I want to agree with Dr. Emanuel on one thing. I want to see the Medicaid expansion preserved. I wanted to see it made more efficient by our Medicaid czar. I want to see bridge to jobs put in. I want to see premium pay-ins on it. But we can cut down on Medicaid costs without getting rid of that expansion. That'll bring in some Democrats.
Dr. Emanuel, a couple of things you want Paul Ryan to do before it goes to the General House.
Well, they do have a $100 billion stabilization fund in there. I don't want that cut. Basically, that does provide some reinsurance to the insurance companies and additional subsidies for people who are sick and are having a hard time buying insurance. Both of those things are really important to actually having a good and stable health insurance market, and I think they need to be preserved. The right wing, the Freedom Caucus, does not like those things. They find them more, quote-unquote, bailouts, but they're very, very essential. And then I think you have an agreement here that preserving the expansion extension of Medicaid is really important. Remember, the Ryan proposal, when scored, will mean that 1 in 5 Americans will not have insurance. That is not a good place to be.
Less
That's the reason.
Right.
Let me just finish.
Let me.
1 in 5 people will not be insured. That means that's why the AMA, the American Hospital Association, is against this bill.
If we have a catastrophic option, if we have a catastrophic option,
thank you very much. Dr. Siegel, Dr. Emanuel, thanks so much.
Great to see you.